Regarding the phosphate, so again, when you are on call or you are in the gastro ward, you will receive this call that the patient phosphate level is low, and what should we do? Again, depending on the results, depending on the results of it. So we have mild to moderate hypophosphatemia, and we have the severe hypophosphatemia. All right. So the references, as you see, is between zero point 0.8 to 1.5 millimole, and depending on the oral, would you prescribe oral or would you prescribe IV phosphate? It is depending on the mild and the severe. So below zero point 0.3, below 0.3, it considered as severe hypophosphatemia, and usually would like to prescribe IV. For the oral, we can give phosphate Sandoz. If it is mild to moderate, we can give phosphate Sandoz, and you can give 2 tablets 3 times a day, 2 tablets 3 times a day for 3 days, and then repeat the phosphate level and see what is the levels, and depending on the result, you continue or jump to IV. For the refeeding syndromes and for those people who suffer from hypophosphatemia, it would be a great idea to jump to the IV replacement directly. And if you had a look here, it will depend on the weight and the level of the phosphate. So according to the weight, so the weight between 61 to 80, we can prescribe 350 mils, 350 mils if it is less than 3. If it is between 0.3 to 0.6, you can give 150 mils, and always remember that it's given over 24 hour. Phosphate given over 24 hour. All right, how to prescribe it on the paperwork. If you open the paperwork, you will find that I'm crossing everything and the bot. So phosphate polyfuser 350 mils over 24 hour, and put your name and put your belief number there. And after 24 hour, you will need to repeat the phosphate level again, and depending on the result, you will consider oral phosphate like phosphate Sandoz, 2 tablets 3 times a day, or to give another phosphate polyfuser IV replacement, especially again in patient with eating disorders and refeeding syndrome. And this is one of the most common electrolyte disturbance in the hospital as well. I will stop there and we'll continue with the hypomagnesemia in the next video.